Hello, I'm Dr. Clement Darling, and this is a Society for Vascular Surgery briefing on structuring your practice and how to optimize time and revenue. During your fellowship, very little emphasis is placed on optimizing time and physician effort in vascular surgery. Your clinical time will be divided between office evaluations, endovascular procedures, the operating room, interpreting vascular lab studies, and research endeavors. The needs of your practice and the needs of the community, as well as an objective evaluation of one's own personal assets and limitations, must be addressed initially. Division of labor usually requires 1 day in the office, 2 days in the interventional suite, and 2 days in the operating room. Keep in mind that in most practices, only 1/3 to 1/2 of revenue is generated through operative procedures. In the first few months, clinical volume is usually low. I would recommend assisting one of your associates whenever possible. This will help you gain familiarity in the operating room, offer additional clinical mentoring time, and provide personal interaction with patients in your new partnership. It is also important that you become part of the surgical community and medical community, attend grand rounds, aggressively assess consults in a timely fashion, respond to referring physicians with a phone call, and in addition, see patients in the emergency room with a positive demeanor and offer your expertise on vascular topics to medicine, radiology, and general surgery grand rounds. Your presence in the community translates into consultations by referring physicians, emergency room doctors, and nurses while educating them that vascular surgeons are also interventionalists. One of the most often overlooked components of the practice is a compliant yet thorough billing system. Most people outsource their billing. However, this does not allow you to ensure that billing codes are appropriate, the denials are being resubmitted in a timely fashion, and the proper reimbursement is being realized. At least one person in your practice should be actively involved in the billing and coding of your interventional, open, and office procedure. This is as important as having a person who can do complex endovascular or intricate open surgeries. The revenue lost due to miscoding or inappropriate submission of claims is staggering. If you are not interested in this aspect of your practice, then it behooves you to make certain that somebody else is. Vascular surgery is a complex, ever-expanding field that includes the diagnosis of arterial and venous disease, endovascular therapy, and open surgical techniques. More recently, this even includes CTA and MRA interpretation. In order to be effective as a practice, a partnership must be examined to identify where each individual excels. It is both inefficient and impractical to have deficiencies that cannot be addressed by one of the associates. This briefing is made possible through a grant from Cook Medical. To learn more about structuring your practice, visit vascularweb.org.